Hi, Andy. How are you?
I'm very well, thank you. How are you, Kelly?
I'm wonderful, thank you. And thanks for spending the time with me today to have a chat about your new recipe book for straight teeth clients. So what is it, Andy, that you love about straightening people's teeth?
I don't know, it's really difficult to say, really. Just meeting new people, finding out what worries them about how their teeth are and how they look because of their teeth. And then ultimately how we can help them and make an improvement into their lives ultimately, because it can change people's lives, you know.
Yeah. Well, I'm actually a former straight teeth patient. I had some straightening done, and it definitely changed my life, and it made a difference. But the one thing I've got to say is that when I had mine done, I didn't have the option to have a look at this cookbook that we're going to talk about. So yeah. It's really exciting. So so just in terms of yourself then, Andy, just introduce yourself. Who are you, and what's your role?
So yeah, my name's Andy Nourish. I set up the practice here in Barry in South Wales near Cardiff about 7 years ago, and we've basically grown the business, and we've got lots of new patients coming into us asking us about braces and straight teeth, implants, and all sorts of stuff. I'm the senior dentist here, and I was here from the start, and we've grown loads. We've seen loads and loads of new patients, and we've done some good things for people.
Brilliant, that's great. So just the first question I wanted to ask you is do people suffer any pain when they get their teeth straightened, first of all?
When they first have the braces on, it can be a bit uncomfortable for a couple of days. I'm sure you remember, Callie, when you had yours on, you know?
Yeah.
It puts a bit of pressure on the teeth, but also just where it rests on the insides of your mouth, it can feel a bit uncomfortable for a couple of days. There are ways to deal with that, you know. You can have wax which goes over the little brackets to help ease the discomfort. Occasionally a little bit of pain relief may be necessary, but generally after a few days, anywhere up to a week, things calm down, and then the teeth start to move and you start to see the improvements and the benefits again.
Yeah, brilliant. I mean, one of the things that I was really pleasantly surprised at was how, the benefits, how quickly the benefits actually happened, for little, for little discomfort. Really, it was a great process, really effective. So in terms of that, then, is there any effect when the braces are first fitted? Does it affect, work or socially or anything like that?
No, not really. I think most people get on with it absolutely fine, and I think most people, once they've actually got their head around having braces and they've got a problem they want to get sorted, they're focused on the end result, you know. So I think people do tend to get on with things. Yeah, definitely.
I know that's one of the things that, like you said, with the waxes and a little bit of pain relief, if there is any, it's basically back into normal life. So just going back to where we're talking about a cookbook that you've developed here, which I've got some questions for you. So one of the things that because it's a few years ago since I had my teeth straightened, and one of the things that I wasn't aware of is eating basically while you've got your braces on. So can patients still eat nutritiously then when they've got the braces on?
Yeah, absolutely. There's no reason why you can't eat most of the foods that you would normally eat, and there's no reason you can't still have a really great diet while you've got braces on. There are certain foods that you might want to avoid because they can get stuck in your braces. Things like spinach, seems to be a particularly good one. I think I remember seeing you, Callie, with picking something out of your brace at one point. But little bits like that, it can be an irritant, and you may find that you actually want to clean your teeth and your braces more often than you would have done if you didn't have the braces on.
Brilliant.
But lots of things, you can still eat easily.
Brilliant, thank you. So what was it that made you think about creating a cookbook then for people who wear braces?
Well, a lot of people, when they first get the braces fitted on, as we said, it can be a little bit of discomfort at the start, and maybe soft diet for a few days can be beneficial, because when your teeth start moving, it can feel quite strange. So soft diet would be ideal to start with, just with some easier to eat foods. But it's also something to take people's mind off the braces, so if they got this little cookbook, it gives them something else to think about apart from actually just the physical process of the braces. It also means that they can still have a nutritious diet as we were saying, as they're going through the treatment.
Brilliant, thank you. So can I just, would you just show us the cookbook? Have you got a copy there?
Yeah, hold on a sec. Yeah.
Wonderful.
See that?
Yeah, perfect. So Andy, what's your favourite recipes then from the cookbook? Have you got any favourites?
Let me just show you my favourite ones in here. Here we go. This was a new one to me, broccoli salad. You know, when I didn't realise you could have broccoli salad. You know, but when we just started doing a bit of research, I was really quite impressed.
So that can take over from the spinach, can it?
Yeah, that can take over from spinach because the broccoli doesn't tend to get stuck in your braces like spinach does.
Excellent.
Yeah, spinach is definitely one to keep away from, Callie.
Okay.
But we got lots of amazing recipes in here. Kind of got stuff from starters and drinks, and there's some nice smoothies. It's just that it was the start of summer yesterday.
Yeah.
Summer fruit smoothie in here, which is a really nice one. But it just says fresh fruit, you know, so you can put whatever fruit you fancy, you know, so it's not really prescriptive, but just giving you the ideas and the basics for what you might want to do. And then as you go further through the book, there's all sorts of recipes, including a nice easy lasagna, you know, and I love a bit of lasagna, and this is one that you can do just very, very easily, you know, because we're all busy people, and having something that's simple to do is great.
Brilliant, thank you. So I think there's about 48 recipes in the book in total, which is enough to keep everybody busy. And one of the other fantastic things is that you've decided not to charge for the cookbook, but you're making it available to people going through the treatment and who are indeed interested as well. Yeah. So just aside for that, just to give a comparison, if people, I know we've got spinach as a good advice not to eat. But if people do carry on eating foods, I don't know if you've got other examples of other food, but what's the outcome if people do have problems if they eat the wrong foods when they've got the braces fitted?
Yeah, a couple of other things. Whole apples can be quite destructive to the braces. You know, if you try and take a bite out of a whole apple, you can actually break the braces off your teeth. If the braces aren't stuck in your teeth properly, they're not going to actually move the teeth effectively and achieve the result you want. So apples are a particular one. So if you have an apple, you can still eat them, but you need to cut them up. Really, really crusty bread would be something to avoid, really, because that's going to cause you problems and potentially cause the braces. Things like curries and highly spiced foods, you know, you can eat them, but the advice we give people is to eat them just before you come and see us, which sounds a bit weird, but because occasionally the elastics can get a little bit stained. Yeah. So really, really spicy curries, you know, can make the elastics discolor a little bit. The elastics get changed every time you come and see us. So if you really have a drive for a curry, you know, have it just before you come and see us, and then we can change the elastics the day after.
That's really good advice. I know that I didn't take anybody up on that one, and I was walking around with the discoloured plastic elastics. So when you say, so if someone eats the wrong food, for instance, crusty bread, what can, so something, you know, what's the sort of solution if something does go wrong when you're eating foods that you shouldn't, because it will happen, I suppose.
Yeah, I mean, basically the things that can go wrong, the elastics can come off of the brackets, and then the wire isn't held into the bracket properly. Yeah. The brackets can actually break off of the teeth, so they're not attached properly. Ultimately, if you have any problems, people just need to get on the phone and come and see us, so we can get it repaired, so that ultimately the braces are doing what we need them to do. Rather than just wandering around thinking, oh, I wonder what I should do about this. You know,
brilliant.
Just get on the phone and always speak to us. If there's any problems, always give us a ring for advice.
Brilliant, thank you. So you can still basically eat the foods that you like within reason, and obviously using the cookbook as well. You've got plenty of recipes there to keep us all busy or to keep the patient busy as well. And also, as we've all mentioned as well, it's free of charge, which is absolutely brilliant. Yep. So basically, we can imagine a future if we're having straight teeth treatment. We can imagine a future where we can still eat the foods that we like, and really, you know, just go for it and enjoy the treatment.
That's right, Kelly. Yeah.
All right. Thanks, Andy.
Cheers, guys. Thanks.
Cheers. Bye-bye.